Good evening.
Hi.
My name is Marlena Sutton. Today I'm here to talk to you about taking your blood pressure with an electronic blood pressure monitor. According to the American Health Association, more than 50 million people have hypertension. 2/3 of the people with hypertension do not even know that they have hypertension. That's why it's called the silent killer. Today I would like to teach you how to take a blood pressure using an electronic blood pressure monitor. Monitoring blood pressure is very important because it could be the difference between life and death. When taking your blood pressure, there are many different instruments that you can use. We have the sphygmomanometer that you can pass around. And when you're using the sphygmomanometer, you will need a stethoscope also once you put it on your arm to hear the lub-dub sound in which your heart makes. There are many different types of electronic blood pressure monitors. You have the one with the cuff, and then you have the wrist monitor. We're going to be using the wrist monitor today. And I need a volunteer. When taking a person's blood pressure, you need to make sure that you always, unless they have had a mastectomy or an injury to the limb in which you need to take the blood pressure on, you need to take it in your left arm because it's closer to the heart and it gets a more accurate reading. I'm going to place this on her wrist and press the start button. The cuff inflates with air as it begins to read. She has to remain relaxed while the monitor is reading. If she moves her hand or opens and closes her hand, the monitor will cut off and it will give you an error message and you will have to start all over again. When you're taking your blood pressure, you need to make sure that the person's feet are flat on the ground and that their arm is at heart level to get a more accurate reading. Make sure that the patient or the person hasn't been exercising strenuously or doing other activities that could affect the blood pressure. Okay, this is done. Thank you. If you look at the blood pressure monitor, you have 3 different numbers on the blood pressure monitor. You have the systolic blood pressure, which is when your heart contracts and pumps blood out. Your diastolic blood pressure is when your heart relaxes and the ventricles of your heart relax and they're waiting for the blood to come back into the heart. And then you also have your pulse, which is how fast your heart beats in a minute. Now your normal blood pressure range is from 120 to 80, and your normal pulse rate should be 60 to 100 beats per minute. Does anybody have any questions about how to use the blood pressure monitor and the importance of it?
The question I have is, what are the symptoms of hypertension?
Nausea, throwing up, chest pain is one of the main. But some of the people that have hypertension don't have any symptoms at all.
Okay, you might not have any symptoms and you could
have a heart attack, yes.
Oh, okay.
I have a question.
Yes.
What can we do to prevent high blood pressure?
Exercise, eat right, and reduce your stress. More questions?
I have another one.
Yes.
What is really systolic and diastolic reading, what does it really determine?
It determines whether you have any blocks in your heart. When the blood pumps out, if you have chest pain, mainly it's primarily because you have a blockage somewhere within your heart.
I have a question.
Yeah.
Which one is higher, systolic or diastolic? When you said the range is between 20 and 180, 20 and 80,
The
120
systolic-
and 80 rather.
The systolic blood pressure is higher.
Oh, okay.
Should be the higher number. If the bottom number is higher, then that means you need to run to the hospital.
Oh, okay. Okay.
Any more questions?
I do have one. The difference between hypertension and hypotension.
The difference between hypertension and hypertension means that your blood pressure is above 140 over 90. And hypotension means that your blood pressure is lower than 120 over 90, which is abnormal, and it may cause dizziness.
Thank
I
you.
have a question.
Mm-hmm.
Is blood pressure, high blood pressure normally found in older people than in younger people?
It varies from generation to generation. They tend to say that African Americans have a higher blood pressure.
Okay, thank you very much.
Thank you.